Hi, my name is Lily Holland. I'll be doing my Accessing Mediport video today. Before I get started, be sure to follow my GPSPs, my 2 patient identifiers, and assess for allergies. So I'm going to go in the patient's room. Hi, my name is Lily. I'll be accessing your Mediport. Can you tell me your name and date of birth? And that checks out, do you have any allergies? And they said no. So the first thing I'm going to do is I'm going to put on a mask for myself and then ensure that my patient has a mask on. I'm going to perform hand hygiene and put on clean gloves. And I'm going to assess and palpate the port site so there's no redness, no tenderness or swelling or any drainage, and no abnormalities noted. So once I've done that, I will go ahead and open my sterile kit, ensuring I'm not contaminating the inside. Okay, and then I'm going to take off my gloves and perform hand hygiene. I'm gonna scoot this box over a little bit, and I'm going to put on my sterile gloves. Okay. I'm going to move my box back over a little bit, still touching the inside, maintaining sterility. I'm going to go ahead and take my cleaning solution and cleanse the site. I'm going to use a back and forth motion for at least 30 seconds. Once I've cleansed the site, I will allow the site to dry naturally. Make sure I'm not fanning it, blowing it, or touching it while it's drying. And while it's drying, I'm going to go ahead and prep my kit. So I'm going to get my port and put on my needless connectors. Okay, once those are on, I will take my normal saline and connect it, ensuring that my clamps are open, and they are. I'm going to go ahead and prime my tubing. And once that's primed, I'm going to take the cap off the needle. And I'm going to sacrifice my non-dominant hand, stabilize the port, and insert the needle. And so it is secured. And once that's inserted, I will ensure my clamps are still open and flush, and I will assess for any leakage. Then I will pull back and aspirate, and there is blood return. And then I will continue to flush using a push-pulse method. And once that is completely flushed, I will then get an antimicrobial swab and scrub the hub and get a cap, put on my cap. And I'll do the same for this one. Scrub the hub. Put on my cap. Okay, so once that's done, I'll ensure that my clamps are closed. There we go. I'll get my Tegaderm. Place my Tegaderm over the port site. make sure it's secure, and then on the tegaderm, I would date it, initial, and time it. And then I would clean up my supplies, perform hand hygiene, and document immediately.